everyone. Thanks for joining us for a live Q&A today about childhood cancer. September is Childhood Cancer Awareness Month. Every day in the United States, 43 children are diagnosed with cancer. And when that diagnosis comes, our team of experts are here to fight alongside them. And one of those experts is Dr. Melissa Acquazzino, who's a pediatric oncologist here at Children's. Thank you for being here.
You are welcome. Thank you for having me.
We're so glad to have your expertise and your time today. And we want to welcome everyone watching. If you have a question for Dr. Acquazzino, please put it in the space below and we'll get to that as much as we can. I'm going to start just very broadly. How common is cancer in children? And do you have any idea what causes these cancers?
Great question, Sarah. So overall, cancer in children is rare, which is good. But we know that 1 in every 285 children will have a cancer diagnosis before the age of 20, which for being a rare disease, that actually sounds like quite a lot to me. And we meet over 100 kids every year that get a new diagnosis of cancer at Children's Hospital and Medical Center. Now, we really don't know what causes pediatric cancer. There is a lot of research going on in this area, but unlike adult cancer, it's usually not caused by a known trigger like smoking or other things. It's never anything that the child or family did or didn't do. We do know that some cancer runs in families, but that's rare in children. The majority of children that we meet with a new diagnosis of cancer, we're not able to give the family a reason why that cancer occurred.
Mm-hmm. Which makes it all the more frustrating and so difficult. Are there types of childhood cancers? Are there big categories of what all of the things you see here?
Yeah, there are. We kind of break childhood cancer down into 3 main categories. We think about the category of leukemias and lymphomas. Leukemias are cancer of the blood cells, and lymphoma cancers of the lymph nodes, and they're related. We think about cancer or tumors of the brain and spinal cord, and sometimes people call those central nervous system tumors, but those fit into a category. And then the final category we call solid tumors, and those are tumors that you can have like in your bones or your organs or your soft tissue. And that category especially encompasses quite a few diagnoses, but we think of it broadly in those 3 categories, and the numbers of cancers that we see in those 3 categories are kind of a third, broken into those 3 different categories.
Mm-hmm. Certainly, it is a devastating diagnosis to any family that hears that from you. So I'm just wondering, kind of as the oncologist, but also just as a human being, how do you share that diagnosis, and what do you tell those families at the start of their journey?
Yeah, that's a great question. That is one of the hardest parts of my job. And so what I try very hard to do is to always be honest with my patients and my families. I also try really hard to be timely. So as soon as I know what's going on, I share that, because it can be a process to find answers for our patients and their families. And so I try to be honest and timely. And then I always try to provide reassurance, because as a mom, I often wonder if those parents are saying, well, what could we have done differently? Is this our fault? And so I try to say that right away, that it's not. Remember, we don't understand why pediatric cancer happens, and we know it's nobody's fault. So I try to say that. And then I try to provide some reassurance or hope or focus on the next steps, because we are able to make a treatment plan for whatever that diagnosis is. And so I try to reassure families that they're in the right place, and we have the expertise and people that they need to start working towards a cure.
You know, you mentioned treatment, and we often say here at Children's across specialties that kids are not just little adults. When it comes to pediatric cancers versus adult cancers, how is the treatment different, and how do they look different than in adults?
Yeah, so completely different. So all children with a cancer diagnosis should be treated by a pediatric team because first off, the diagnoses that we see in kids often aren't encountered in adults or are very rarely encountered. So the types of cancer are very different. Even for types of cancer that we can see in adults and children, the way that they behave in children and the way that they're treated, how they respond to treatment is often very different. And we have pediatric focused specific treatment plans for the diagnoses that we treat. And so, absolutely, it's a very different. And I always caution my families to be very careful when they Google things because most typically prognosis and outcomes in adults is worse than in children, which is a good thing for our kids and families. So I'm very careful that we provide pediatric focused resources for our families so that they're getting the right information.
Yeah, yeah. Sometimes Google is not your friend. It's not helpful. You mentioned survival rates, and I can't imagine how much this has changed survival and treatment in the last even probably 5 years, let alone 20 years or 30 years. Like, can you kind of give us like a recap of how far we've come in our treatment and our understanding to fight cancer?
Yeah, absolutely. So in the past, there were diagnoses that were not treatable. And now we're achieving cure rates greater than 90% in some of those diagnoses. So things have come a really long way. And we've done that through clinical trials, through working with other institutions to treat children with a specific diagnosis in a certain way, and then learn from that treatment and make improvements as we go forward. So our group here at Children's Hospital and at University of Nebraska Medical Center is part of the Children's Oncology Group, or COG, as are most pediatric institutions around the country and even in several other countries. And that's so important because that allows us to participate in those clinical trials to offer the most recent, most up-to-date, best treatment to our patients and to continue to learn how to improve outcomes.
So what I'm hearing is there's a lot more hope, it sounds like, in the community and with all the exciting research happening right now.
Absolutely. We still have areas we need to improve, and we know that, and we are motivated to make it better for the patients that we'll meet in the future. Unfortunately, there are still certain diagnoses in pediatric cancer where outcomes are very poor. And then in addition to improving outcomes for certain conditions, we're always looking to decrease toxicity of treatment because unfortunately the treatments that we do use to achieve good cure rates have a lot of short and long-term side effects.
Yeah, what are sometimes some of those long-term effects if you are a survivor of childhood cancer or if you're in the thick of the fight?
Yeah, absolutely. So getting to survivorship is a really big celebration and super exciting, but our survivors do need lifelong monitoring for possible complications from treatment. So the three biggest types of treatment that we use for pediatric cancer are chemotherapy, which just means medications to treat cancer, radiation therapy, and surgery. Those are our big different types of treatment, and they each come with some own potential long-term side effects. And so the risks for each of our patients depend on the exact treatment that they got, but can encompass head to toe complications. So we can see long-term difficulties with learning. We can have vision or hearing affected, heart or lungs, kidneys. We can see infertility. We can see increased rates of depression or anxiety. So all of those things, when our patients are seeing us in follow-up as a long-term survivor, we're trying to do a really good head-to-toe assessment and see how things are going with their health, kind of head to toe.
And this is really an area of passion for you. I know you're one of the leaders of our survivorship clinic. What is so unique about this program and this approach to helping survivors?
Yeah, yes, I love taking care of our survivors. It is definitely a passion of mine. And we formed a dedicated survivorship clinic a little over a year ago. And what we are trying to do through this clinic is to provide a multidisciplinary care approach. As we talked about, our survivors can have health complications from head to toe. And so I work together with physical therapy and behavioral health and social work to kind of try to address our entire survivor and help our families navigate medical, social issues that might come up for their survivors.
I think that's such a good point that it's this has a bigger effect than just the body, right? Like it affects the mind, and I love that kind of team approach.
Yeah, I do too. I love working within a team. And one of the really exciting things about this clinic is we've been able to identify some people in each of those areas that are really passionate about our patient population and really committed. And so we're developing a greater level of expertise so that we can stay on top of all the new things that we're learning about how to best take care of our survivors.
You had mentioned earlier, Dr. Acquazzino, the power of research and the exciting work being done right now here in Omaha to make a change and improve the lives of children. Can you kind of give us an overview of some of the physician researchers' work and the work these teams are doing to make a difference?
Yeah, absolutely. I think we are really committed and passionate to research. And the reason for that is that's how we're going to make outcomes better. That's how we're going to improve quality of life and decrease cost of care over time. And so, Omaha, our Children's Hospital Medical Center, University of Nebraska Medical Center, is doing really amazing research in the area of pediatric cancer. There is an impressive amount of support both from the university and the Children's Hospital to provide the infrastructure that we need to be able to do this type of research. And the collaboration, the innovation is really spectacular and pretty unique compared to other places I've been. It makes it a great place to work and to take care of patients. And I think our patients and families directly benefit. And so it has allowed myself and my colleagues to grow and develop and build research in the areas that we're most passionate about. So for me, that's survivorship. And I was just supported and got a grant to be able to look at how to improve bone health in our pediatric cancer survivors, which has impact on quality of life and long-term health. And so that's been really exciting. But I have partners. Dr. James Ford just got a really big, amazing grant to further look at how to prevent and treat osteosarcoma in children. And he is a clinician like myself, loves to take care of his patients, but has made amazing research collaborations with our PhDs and researchers that work in labs at the university. And that's how you can make really amazing things happen, putting together people that can think about the same disease process in different ways and figure out how to take science, things we're learning in the lab, new science, and help it benefit our patients. And there's a lot of those types of projects going on here. Dr. Don Coulter has been instrumental in building those relationships and building our pediatric cancer research group and in making those connections happen, which is allowing for some really amazing projects and more to come in the future, I'm sure.
Yeah, congratulations on that grant and to Dr. Ford. And it is very exciting. Those hopeful just to unlock some discoveries to help kids. So we did have a question from Facebook from Whitney that I wanted to get to. What are some of the best ways that we as a community can help pediatric oncology patients and families locally? And what can we do as a community, as for those watching, to offer support to the families that we serve at Children's? What can we do?
Yeah, great question. Thank you, Whitney, for that. There's a couple different things that come to mind. The first is that we actually have more than I could name. We have quite a few amazing philanthropic groups right here in Nebraska that do wonderful things for our patients and their families directly, and also support the Survivorship Clinic and other programs like our brain tumor clinic, which is an amazing multidisciplinary clinic for our brain tumor patients, and support research too. So if there's anyone that's ever in a position to give, September is Childhood Cancer Awareness Month. I know there's been a big push on social media to just be aware of the problem that this is, the impact it has in our community. And there are a lot of different ways and groups that you could give to. If you shop on Amazon, you can look for some of those groups on the Smile Amazon, and you can put your money to good use there. And then other ways that to be supportive would be to donate blood if you're able to. Our patients going through treatment need blood products, and some need a lot of blood products. And with the current COVID pandemic, I think we are experiencing blood shortages nationally and in our community. So that's something that if you're able to, people can do. And along that similar line, some of our children with cancer go on to receive a bone marrow transplant as part of their treatment. And anyone can sign up to be a bone marrow donor on bethematch.com. So I'd encourage you to look at that if you're not registered. It's something that you can do. And finally, if you know a family that is affected by childhood cancer, just reach out and see how you can help. In my experience, that looks different for all my different families I treat. But I will tell you, the support that each of my families receives from their community is amazing, and it helps them get through.
Yeah, I'm really glad you brought up bone marrow because I think a lot of times people don't think about that. They think of the blood, the
Mhm.
ability to donate bone marrow. And great question, Whitney. Thank you for asking that. And I'm hoping that some of those amazing community groups that are really passionate about pediatric cancer, put your link to your website in the comments. Get the word out. We want to all pull together on this topic. So I always like hearing like the personal backstory, and I wanted to just ask you, why pediatric oncology? I'm sure some people would say, "Oh my gosh, that has got to be the hardest job ever. Like, how do you do it?" Because that is a hard thing to tell someone and walk through with another person. What about pediatric oncology attracted you, and what do you just love about your job?
Yeah, great question. I do get that response a fair amount when I tell people what I do, like, oh, how could you possibly do that? And of course, I love my job. And there's a lot of things I love about it. And the reason I went into pediatrics initially is children are amazing. They're resilient, and they inspire me to try to do my best every day. And so I love taking care of kids. I didn't know I would be an oncologist when I first started, but when I was doing my pediatric residency, where I learned how to be a pediatrician and got to really dive in and take care of those patients and their families for the first time, I just fell in love with it. There's something really I feel very honored that families allow me to walk through this with them. It's a big job, and one that I want to do really well. And so it's a special job to get to do. I love to teach. I love to teach our medical students and our learners, but I also really love to walk through that and explain to my patients and families what's going on and what the options are. And that's a piece of my job that I love. And then absolutely love survivorship. So I love to get to see these patients after cure, and focus on keeping them healthy lifelong.
What have you learned about, I don't know, about life, about the resiliency of children? What have you learned from your patients and families, and being on that journey with them?
Yeah, great question. I think two of the main things that I take away from my job each day, that I get directly from my patients and their families, are motivation. So motivation to come back after maybe having a really hard day, where something didn't go the way that we wanted it to go. Motivation to do my best, and motivation to put forth that extra effort, to contribute positively in research, to learn more, to make a difference, because we've achieved a lot of success in our area, but we all want to do better. And so my patients and their families, their resiliency, their is incredibly motivating for me professionally. And then personally, I mean, I think it's changed my entire perspective on what matters and on seizing the day and on how I'm a mom to my kids and in a very positive way, I think.
Yeah. So very aware that you kind of made me get a little teary when you said that, but very aware that there are likely families fighting this right now. What would you say to those families, whether they're in the middle, at the beginning, or maybe they are looking back as a survivor?
Yeah, I would just say thank you for trusting us with your care, and um, yeah, we're fighting for you. We love what we do because of you. You make our job very worthwhile.
Yeah. It is an honor. Thank you so much for the honor of your time and sharing your expertise with us today. Really appreciate it.
Yeah, absolutely.
And thank you to those who have been joining us, and of course, a special word of support to those families as well. We've enjoyed this chat, and we want to encourage you to visit children'somaha.org, and you can always follow us here on Facebook, Twitter, Instagram, YouTube for stories and information as well. Take care, everybody.
Thanks.